Hello everybody. I wanted to welcome you to today's Lunch and Learn, and I wanted to thank you for being here today. Today we'll be talking about autonomy, role ambiguity, and collaboration for nurse practitioners as novice NPs and how that affects their turnover. Today's webinar is being recorded and will be available in the upcoming week on our Nurse Practitioner Support and Alignment page, and a link to that recording will be sent out to all the participants and registrants. All participants will be muted throughout today's presentation. I encourage you to submit questions during this presentation. Please use your Questions tab on the GoToWebinar control panel as seen here in order to ask your question, and it will be relayed to the presenter and answered at the end of the webinar. A survey will pop up also at the end of the webinar and will be sent out in an email later today. Please take a few minutes to complete this survey to evaluate this activity, as your feedback is critical to the ongoing development and presentation of our webinars. You will also have a survey related to the continuing education credit, which is unrelated to our survey, so please be sure to fill them both out. The slides for today's webinar are available as a handout, which you can access via the Handouts pane, as seen here as well in your control panel. You can click on the name of the handout, and it will be downloaded via your default web browser. At this point, I'm going to turn it over to Joseph at the AANP to tell you how to receive free CE credit for today's webinar.
Hi everyone, this is Joseph with the American Association of Nurse Practitioners. Today's webinar is accredited for continuing education credit. There are two major requirements in order to receive CE credit today. First and foremost, you have to attend at least 55 minutes of the presentation, and that attendance must be as you are viewing the presentation in real time, slide by slide. So you need to log in so that you can view the presentation in real time. If you phone in only and you attend 55 minutes of the presentation, you won't qualify for CE credit. There's no way for us to track that. So in order to track your participation, please log into the presentation and view it in real time. In about 1 to 2 days, I'll vet the list of participants, and I will send a personal email on how to receive your CE credit on the AANP-CE Center. That will require a passcode and the completion of an evaluation that will be provided in the email. Keep in mind that the survey that you complete after the webinar to evaluate the webinar presentation is not the same thing as the evaluation that you will complete on the AANP-CE Center. If you have any questions in the meantime, you can reach out to me at jreyes@aanp.org.
Thank you, Joseph. I wanted to spend just a moment before we get started today to talk about the national investment that's taking place for quality healthcare improvement in the U.S. with the help of our federal government and the organizations who are presenting this content today as part of the Transforming Clinical Practice Initiative. Transforming Clinical Practice Initiative, or TCPI, is CMS's largest ever investment in practice transformation, with an investment of over $700 million over 4 years and an enrollment of 150,000 plus providers across the country. The NNCC, my organization, or the National Nurse-Led Care Consortium, is a membership organization with nurse-led practices on our membership roster. Our mission is to advance nurse-led care through policy, consultation, and programs that reduce health disparities and meet people's primary care and wellness needs. Our partner in this initiative is the American Association of Nurse Practitioners, the largest full-service professional national membership organization for NPs of all specialties. The AANP is leading the way in advocacy, continuing education, and professional development for over 80,000 members. The NNCC and the AANP agree that this initiative is important to ensure that NPs receive the support they need to remain competitive in a changing healthcare landscape. NPs are the future of primary care in the United States and already provide high quality and cost-effective care. This initiative is an opportunity for NPs to prove that by helping CMS and the broader healthcare community build the evidence based on practice transformation while preparing for value-based reimbursement. At this time, I'd like to turn the presentation over to Dr. Faraz to talk to us about NP intention and turnover. Dr. Faraz?
Thank you so much, Cheryl. And thank you so much to NNLCC AANP for hosting me here today to share my research with you all. I'm really thrilled to be joining you this afternoon to talk about the nurse practitioner workforce transition and turnover intention within primary care settings. First, I'd like to tell you a little bit about myself. I am an assistant professor at the George Washington University School of Nursing, and I received my Master of Science in Nursing as a family nurse practitioner from Yale University, as well as my PhD in nursing science from Yale University. I've been a family nurse practitioner for 10 years, and I have been conducting research on nurse practitioners for the past 8 years. This is my passion and my area of expertise, and I'm always happy to discuss this topic with anyone who would like to discuss it further, and I will be including my email address in this presentation. So let's get started. My slide's not advancing. Okay, thank you. So I have no disclosures to declare, no conflicts of interest. So today I'd like to share with you the findings of my study, as well as discussing the real-world clinical applications for improving the factors identified as being important to the successful transition of novice NPs. So we know that the U.S. is facing a large and growing shortage of primary care providers, and in this instance, primary care is defined as the initial point of entry into the healthcare system and source of ongoing healthcare services. An aging population with increasing chronic medical conditions, millions of newly insured, and recent data revealing only 40% of clinicians practice in primary care all contribute to the growing and critical need for PCPs. NPs are increasingly being called upon to meet the growing demand of PCPs.
Are you communicating?
NPs have demonstrated the ability to deliver high-quality, cost-effective health care with high patient satisfaction. The IOM Future of Nursing report called for greater attention to the transitional period of nurses following degree completion. And we know that as many as 1/3 of new NPs change jobs within the first year. This is important because some NPs may remain in an apprentice-type position from which it is very difficult to move into full professional status, according to Margaret Flinter. For the purpose of the study, the following definitions were used. Novice NP was defined as one who has completed an NP program within the past 18 months and who is nationally certified. A successful transition was defined as those with increased role acquisition and job satisfaction, leading to decreased turnover intention. Turnover intention was defined as the likelihood of staying in their current position or in the NP role as a direct care provider. The research questions I set out to answer were, what factors are associated with a successful transition and turnover intention of novice NPs in the primary care setting, and what factors are most important for this successful transition and turnover intention? In reviewing the literature, I found that few studies to date have analyzed the novice NP transition to primary care, with only 10 articles published in the past nearly 20 years. The main themes I found were role ambiguity, feelings of self-doubt, confusion and guilt, lack of role acceptance, clinical support and necessary time to adapt, and the importance of social support, mentorship, and positive colleague relationships. There was no existing theoretical framework that adequately captures the Novice NP transition. Little research has been done on the Novice NP transition, and most of this research has been descriptive. Therefore, based on the review that I conducted of the literature, the following factors were theorized as contributing to a successful transition in Novice NPs. Individual characteristics, including educational background, such as type of NP program, prior work experience in healthcare settings, particularly as a registered nurse, the presence of mentorship, and sense of meaning for their work. Role acquisition, which includes role ambiguity, which is a lack of clarity related to one's role, perceived competence and self-confidence in clinical skills, which is a feeling of security regarding ability. And finally, the area of job satisfaction, which is the extent to which employees like their work and includes professional autonomy, quality of professional interpersonal relationships, time to complete the work, and job benefits. The hypotheses that directed this study were that novice NPs with certain individual characteristics will have lower turnover intention in primary care settings. Those with greater role acquisition will have lower turnover intention in primary care settings, and those with greater job satisfaction will have lower turnover intention in primary care settings. So the variables that were used were the individual characteristics, traits relating to a person that distinguishes them from others, role acquisition, which is decreased role ambiguity and increased perceived competence and self-confidence in one's role, and job satisfaction, which is the employee's surroundings, personal beliefs, individual characteristics and expectations, and satisfiers and dissatisfiers being unique to that individual. This was a cross-sectional quantitative design study. This survey was administered online via the survey software Qualtrics, and 177 novice NPs in the US who had graduated from an accredited NP program within the past 18 months and had been practicing in a primary care setting for a minimum of 3 months and a maximum of 12 months participated in this study. Accredited Master's NP Program and Primary Care NP Residency Program Directors were contacted to distribute a recruitment email with the survey link. The recruitment letter and survey link was also posted on Facebook and LinkedIn. A $5 Amazon gift card was offered to participants who completed the study. A demographic questionnaire and a number of previously established valid and reliable skills to measure the independent and dependent variables in this study. Educational, work experience, and mentorship were measured using the demographic questionnaire. Social support was measured with the social support questionnaire, which was condensed from 6 to 2 items and included a 2-part question regarding the perceived availability and satisfaction of support. Sense of meaning was measured with the psychological empowerment instrument meaning subscale regarding the importance and meaning of work. Role ambiguity was measured using the role ambiguity scale that contains universally applicable items to role ambiguity in any position. Perceived competence and self-confidence was measured with the confidence scale, which measures self-efficacy for physical assessment. Job satisfaction was measured with the Meisner Nurse Practitioner Job Satisfaction Scale, which includes 6 subscales: challenge and autonomy, professional growth, inter-practice partnership and collegiality, professional, social, and community interaction, time, and benefits. Turnover intention was measured with the anticipated turnover scale about an employee's possibility of voluntary termination and has widely been used in studies with RNs as well as a study with NPs. Participants were asked 4 screening questions to determine eligibility. The survey consisted of 101 Likert type questions with skip patterns depending on responses, and 5 open-ended questions. The participants returned to complete the survey and had the option of providing their email addresses on a separate page. Data analysis included scale reliabilities and descriptive statistics and 2 multivariate linear regression models to determine the factors most predictive of turnover intention in this sample. While it is difficult to calculate a true response rate since it is unclear how many NPs received the recruitment letter, at least 29 NP programs and 5 NP residencies sent out the recruitment email. 293 participants started the survey. Of those, 207 met the inclusion criteria and 177 completed the survey. The average age of participants was 35 and the majority were female. The majority were married and Caucasian. Most participants were family nurse practitioners practicing in primary care settings with equal geographic distribution within the U.S. The 3 variables most highly correlated with turnover intention were entered into a hierarchical regression. And from this, professional autonomy and role ambiguity remain significant predictors of turnover intention. So in conclusion, the results found that professional autonomy was the most predictive factor of turnover intention in this sample of novice NPs. In other words, those with greater professional autonomy had lower turnover intention. Role ambiguity was also a highly predictive factor. Those with less role ambiguity had lower turnover intention. And again, role ambiguity was defined as a lack of clarity related to their position or role. Interestingly, the quality of professional and interpersonal relationships was not statistically significant in the quantitative portion of this study, but it was an important factor based on the open-ended responses in the qualitative portion. There were a few limitations to this study. Those with particularly polarizing experiences may have been more likely to participate. The length of the survey may have been a deterrent. Feeling safe in having their anonymity maintained was an important factor in the openness and honesty of participants. And because this was a cross-sectional quantitative design and regressions were used, only one time point was measured and only correlations can be derived from the results of the study, not causation. This study bridges the gap in the literature related to novice NP transition and turnover intention in primary care settings. It may guide the continued development of transition to practice programs. At the policy level, it may influence state and organizational policies related to NP autonomy and scope of practice issues, which is certainly a very timely topic, and provide greater clarity of the NP role. Earlier professional socialization, career resources, and professional skills training and interprofessional education are potential future components of NP educational programs to decrease role ambiguity and promote professional autonomy. Now I'd like to discuss a few recommendations and action items that can help apply these findings to a real-world setting. There needs to be increased clarification of the NP role and responsibilities within many organizations. NPs should be practicing to the full scope of their education and practice, and increased collaboration among the healthcare team is vital. So here are a few things that NPs and employers can do to engage in improving the transition to the workforce as well as the practice setting for NPs, especially new NPs. So NPs can make sure that they gain education regarding their job search and contract negotiation so that they are going into settings that are a good fit for them. Employers should simultaneously be developing NP job descriptions that are clear so that they are aware of what an NP's role would be within their organization. NPs should be aware of state scope of practice laws. Employers can provide a handbook of roles and responsibilities to the healthcare team, and this includes providing this handbook to all members, including the receptionists, the medical assistants, the nurses, so that all members of the healthcare team are aware of what the NP's role is. NPs can inform their employer about the NP role, and if there seems to be a disconnect or confusion about what an NP does in a primary care setting. Employers can educate the healthcare team on NP scope of practice by holding meetings or webinars to provide this information. NPs can be active participants in educational opportunities such as ground rounds, forums to disseminate clinical education to the entire clinical care team. And employers should be providing opportunities for NPs to be participating as leaders within interprofessional collaborative teams. This can be more formal, such as ground rounds and presentations, and it can be more informal, such as community outreach programs or even social gatherings. So in conclusion, NPs are a vital part of the healthcare team. Successful NP transition to practice impacts their job satisfaction and their retention in the primary care setting. NPs and employers both have a role in ensuring the success in the workplace and should be working collaboratively to ensure that this takes place.
Thank you so much for that information. I think we've opened a lot of doors for a lot of good discussion around this. At this point, I just wanted to invite people to chat in any questions they might have on the questions box. We will read those off and get those answered for you today. I did want to start out with one question that we have from Mary, and this is asking, how can a new grad FNP work with an OBGYN provider or get certified in women's health? And I'm not sure that that would necessarily be your area of expertise, but maybe you can talk about that a little bit.
Sure.
With coming out of coming out of school and then suddenly looking at your job opportunities.
I'm happy to answer that question, and thank you so much. It's true that FNPs have a broad base of experience, so often can go into many different specialty settings. They should not necessarily be limited by looking at only primary care FNP physicians. With that being said, oftentimes additional training is necessary. This can be provided on the job if the employer is willing to do so, or additional education needs to be obtained, at least in the form of a certificate. So I think the important thing here is really clear communication and dialogue with this employer. If it is just a physician who's running their own practice, being very clear up front about how much experience one has in women's health in this instance, and you know, what areas they feel that they could use additional practice, either with procedural things like inserting IUDs, or with pap smears, or with discussing prenatal care or birth control, those types of options. So just being really honest with yourself about where your strengths and deficits lie, but also being really a clear communicator with that potential employer on whether or not the tools for you to succeed will be there within that setting, if they're willing to work with you, mentor you, or provide you with additional opportunities for training. I think that's so important. Otherwise, you know, women's health NP is an educational pathway that one can also pursue. And I don't know too much about getting certificates in that area, but certainly that is another opportunity, I'm sure, as well.
Thank you, Dr. Faraz. One thing I just want to mention to everybody on the line, if you are looking to work in a specialized area, you do need to know your state laws and how you can practice and what you would need possibly for supervision and or collaboration and or certification. So just make sure that you're practicing within the scope of the law of the state that you're in. So I just wanted to be sure and mention that because it's going to be different from state to state. Another question from Cordelia. It says, as a new grad, this is fascinating. Thank you so much. So did you distinguish between the subjects who attended entry to practice NP programs versus those who worked as RNs in a more traditional route to the NP employment? If yes, what were the differences between the two groups?
Wow, Cordelia, this is such an excellent question. I love this question because, as a matter of fact, I did, and I was very interested in this. Is there a difference between those who have more RN experience? So that was one of the things that I did look at with my research, and what I found was, for one thing, this sample that participated in the study was a sample essentially of more experienced RNs. So perhaps that may have skewed the results to them wanting more autonomy as opposed to maybe more support. With that being said, I did specifically look at the difference in perceived competence and self-confidence of those who've gone through accelerated master's program versus those who've gone through a traditional program with an RN experience background, and I did find that there was a difference. There was less perceived competence and self-confidence in those who had gone through an accelerated program. My interest is following up with those folks and seeing if that difference did hold to be true once they've been out in practice for some time, and I think that would be very interesting to look at in future studies.
Great, thank you. There are many questions about fellowships and residency programs. So I will just say off the bat that fellowship and residency programs may or may not be associated with your education. The residency programs that I am aware of are on-the-job training, and they're going to be different every place that you go, but there have been questions about those. You know, are they paid? How do you find them? Mm-hmm. So if you have any insight on that, Dr. Faraz, that you could share with the group?
Yes, I'm happy to. So let me just start by saying that one of the things I asked these participants was their willingness to participate in a transition to practice. I'm just calling them generally a residency or fellowship program. I'll refer to as transition to practice programs, okay, just for the sake of brevity. So asking them their interest in transition to practice programs, and a really high percentage, about 2/3, indicated that yes, they would be interested in that program if it was available to them. So we know there's great interest. We also know that there have been a proliferation in recent years of various transition to practice programs, and as Cheryl mentioned, they're varied, okay? Some of them will be in community health centers. Others are very specific to specialties such as emergency medicine or dermatology. So it just depends. If you're someone who's an FNP who's very interested in a specialty, you might go for a specialty-specific transition program that gives you those additional skills and training. If you're someone who just wants to do primary care, but you're feeling like you want a little bit more extra support, there are residency programs in primary care. There are a number of those. Now, the majority of them are paid, but because there's no funding through Medicare in the same way there is for medical residencies, they tend to be lower than a regular starting salary for an NP. So that's something to keep in mind. Often the NP residencies are 1 to 2 years, mostly 1 year. Some of them are 6 months. And the ones that I'm aware of are structured in terms of NPs having their own panel of patients, but they do have didactic material throughout the year, as well as support sessions that include journaling, that include one-to-one consultations with their dedicated mentor within the setting to help with some of the other issues that come with being a new NP. So I think they're a great opportunity. There are not too many, but there's certainly more and more coming out, and I'm happy to share the ones I know about with any of you who may be in that.
Thank you, Dr. Faraz. There have been a couple questions that have come up around negotiating contracts and tail insurance, I guess, medical malpractice insurance. I don't believe that is Dr. Faraz's area of expertise. There are webinars we have done in the past specifically on those areas that I would point you to. When we get to the end of this presentation, there's a link that will take you to prior webinars that we have done. So that would be a good place to look for that, and is probably another whole discussion about how to negotiate a contract. I don't know if you had anything else to say on that.
I think it sounds like there are a lot of really great resources out there. I will just say that the only thing I would add, and I'm sure this is covered in the other presentations, definitely review the contracts very carefully, and if you have access to a contract attorney, go ahead and use that person, and you just want to be really careful, read through that contract, and definitely negotiate.
Right. And if there's one thing I would say to spend your money on, it would be a contract attorney. It is money well spent. It will be sure that you get what you're entitled to as a new provider. We had a presentation on legal aspects. There are a number of nurse attorneys, and there's a national association for nurse attorneys. That would be a good place to find an attorney to do that. There have been a number of questions too about practicing to the fullest extent of our training, and wondering if there was any correlation between those that are in reduced practice states with not only job satisfaction but also turnover.
I just love this question because this is something I'm so interested in. One limitation of the study was, although there was very good geographic representation, so there were participants from all areas of the U.S. However, when I went to look at state-specific differences, the limiting factor was very small sample sizes from each state. So for example, having 5 participants from Vermont or 10 from California really wasn't enough to be able to make any correlations or make any type of inferences about whether or not the state scope of practice did have an impact in this case of job satisfaction and turnover intention. One might make the inference that since professional autonomy is the most important, those with limited professional autonomy may have decreased job satisfaction and therefore be more looking for a new position or to move out into a position that offers them more professional autonomy. That I could not say from the findings of this study, but I'm certainly working on follow-up studies to look at this very issue because it is very important in our current practice environment. Thank you.
A question about the findings and if they would be applicable to other medical subspecialties, or do you feel that the work that you've done is very NP specific in terms of turnover intention?
Well, that's a really excellent question. I want to not be overreaching with this research. This research was only conducted in novice NPs. Even to say, you know, in my mind, I believe there is applicability to all NPs with the findings of this study, with wanting more autonomy, with wanting a clear definitions of what their roles and their scope are, being able to practice to their full scope. I think that is applicable to all NPs, certainly. Beyond that, to other healthcare providers such as physician assistants, having worked clinically for 2 years, that would be the case. This research cannot say that. It is limited to the population that it studied. So right now, this research only applies to new NPs, but I think a future research area would be wonderful to go ahead and expand this out and survey other healthcare providers to see if this does hold true. And my sense would be that yes, it would, just from other literature that's out there as well as my clinical experience.
Thank you. There's a couple questions about knowledge gap, and I'll just basically paraphrase. So people are asking, you know, I'm getting out of school, I don't necessarily know everything that I will need to know, and just kind of filling in that knowledge gap. And the only thing I would say about that, just generally, I mean, having been an NP for almost 30 years, is when you come out of school, you're not going to know everything about everything. So if you need additional training in a particular area, whether it be suturing or reading x-rays, which I know are 2 that come up a lot, it really is incumbent upon us as providers to seek out continuing education in those specific areas or additional training. So again, you know, no program can give you everything, and learning about healthcare is a lifelong process. So that is the one piece of advice that I would give those who feel that they're not coming out and you don't have all the skills that you need. You will never have all the skills that you need. So,
absolutely, Cheryl. I just love that statement because, as Cheryl said, you know, I've been an MP for a decade now, and nearly every day I am looking something up because guidelines are always changing. So you're never going to know everything because even when you think you do, something new comes in or the guidelines change. So that's one thing. Hopefully something that will give those of you comfort who are a little anxious perhaps about your knowledge gap is that one of the things we know from research is that NPs really go from novice to feeling very comfortable in the first year. So within a year, that comfort does come in their competency and their clinical skills, because often they're repeating a lot of those same tasks over and over within that year. Hopefully that gives some comfort. In addition, yes, I agree that there are opportunities to get additional training within professional organizations and conferences. And finally, I'd like to just encourage everyone to use your resources. If you don't have access to up-to-date in your clinical practice setting, that's something that you can use your professional development funds to gain access to. There are other resources now. There's so many great apps that you can download, and such as Hippocrates to look up medications. There's med calculators that you can use, BMI calculators. There's so many wonderful apps out there, and just be a lifelong learner. Try to read the AANP Smart Brief that comes out that summarizes new evidence-based research and things like that, and that will really help. And use your colleagues as resources, because at the end of the day, you're all there for the same reason, and it's to take care of those patients. So you're in it together, and a lot of your colleagues will have different knowledge, or more experience that can be useful to you. And I think everyone who's been in clinical practice will agree that our colleagues are a rich source of knowledge for us as well.
Great. There's a question asking about suggestions for new graduating NPs who are beginning to look for a job in a community-based setting after graduation, and how to network. And I think it means not only getting a job, but being able to use a network both to find jobs and also maintain those jobs.
Well, this is really challenging. I encourage those who are looking for any job to use their professional organizations. I know AANP does have a student membership option, which is a discounted rate, and it does provide access to a network of NPs as well as to job listings. I also encourage you to use your alumni networks. If you know that you're in a particular geographic area or moving to one, go ahead and reach out to your alumni office and ask to be connected with other alumni in practicing in those areas, and see what connections they may have. Besides that, you can reach out directly to the organizations and request perhaps an informational interview, or speak with one of their nurse managers as well.
Thank you. The question, well, I guess more of a comment, comes up about being referred to as mid-level providers. I'm finding that less and less personally. I think it's, again, incumbent upon us as providers to let those who name our profession, if they are naming us incorrectly, to stop them and say, hey, I'm not a mid-level provider, I'm a nurse practitioner. So I think we've been very leery of doing this professionally. It seems like it's an unprofessional thing to do, but I think if you called a doctor by something other than a doctor, they would probably correct you. So it's just kind of a bone of contention with me that we do not advocate for our profession as we should. So my response to that is just, if that happens to be the case, you can politely call out the fact that we are not mid-level providers, and let your colleagues know, and have that being an ongoing conversation wherever you are. So advocate.
Absolutely. Absolutely, Cheryl. And I just want to say briefly that this, in my latest practice setting, this absolutely came up. We have NPs and PAs. So I just offered, I was asked, well, what term would you prefer? And I offered up some alternatives. And now from here on out, they have been calling us clinicians, which has been really a nice change, because it was mid-levels before. So this is very important, as Cheryl said. Please do speak up.
Great, thank you. What strategies would you suggest for negotiating a salary? Again, this is, I think, a sore spot for many of us. I think it's difficult to talk about money. The issue is, if you don't talk about it, if you don't advocate for yourself, you're probably not going to get what it is you need or want. But I'll just throw that out there to you and see your thoughts.
Absolutely. Well, I'm wondering if we should do a follow-up. I know you've got webinars on this topic, but I actually do give a talk on job search and negotiation at my university, because I know this is direly needed and not included in curriculum. So I'm always happy to share that information as well. What I will tell you from doing some research is it's really important to do your research. And what that means is going on Glassdoor, Indeed, or some of these other sites to figure out, salary.com is a good one as well, to look at the NP salaries within the area that you're looking, because you really have to know what the average salaries are to be able to then use that as a starting point for your own negotiations. So that's really important. You have to do your research and you have to really know what's going on in the market that you're in. That's the first and foremost. Beyond that, I would offer you to do a lot of reading on negotiation and utilizing professionals. Sometimes for just a few $100s, you can utilize a negotiation expert to help. But at the end of the day, know that once you have the job offer, it will not be rescinded. You have that offer. You know, don't go into it from a place of fear. Go into it from a place of you're the one who's been offered the position, you're the one that they want, and now negotiate to make it work for you. And always be flexible and keep in mind that it's not just about money. You can negotiate other aspects. So be creative. You can negotiate other aspects of your contract, such as some of the benefits. And so there's a lot of opportunity there. But yeah, first and foremost, doing your research.
Great, and I think you and I will talk offline about that follow-up webinar, because I would say probably 2/3 of our questions are from NPs that sound like they're new and starting out, and just real basic questions about, you know, negotiation, job search, and all of that. So you and I are going to work on setting up a follow-up presentation, because clearly there's an interest here.
I love it.
Good. There's an academic person working in an academic setting who's asking about interprofessional education. Can you speak more about what that means and what that might look like in an academic setting?
I really enjoy this question because this is the future of healthcare professional education. And what that means is starting out within our training programs and having courses where nurse practitioner, PA, and medical students are combined for some of their coursework. A lot of what we're teaching is similar across the board. So I've been at various institutions that have combined parts of their curriculum. Let's say, for example, an anatomy course is taught one time and all the students come to it and they're engaging with one another. They understand that they're all learning the same information and just learning what each other's roles are. And I think also having a professional roles course would be helpful, just to go through and explain the different roles of different healthcare providers. And that also includes the support staff as well, because, you know, not everyone has exposure to working in a clinical setting prior to their education. And so they're not necessarily aware of the different roles of the different healthcare providers and staff that are working with them. So I think this is just really important to offer more courses where there is a mix of all the healthcare professional students together, so they are understanding one another's role and able to work with each other before they graduate, because sometimes the first exposure they're getting to a different healthcare provider role is once they've already graduated and in the healthcare setting, and we want that to certainly start earlier.
Great. A couple questions about transition to practice. One is asking, you know, obviously coming from a nursing framework in school and transitioning over to the quote-unquote real world, there may be a disconnect in how healthcare is actually viewed and seen. So just questioning how you do that. What's a best practice in terms of understanding what is expected of you, say in a first job, with the framework of that particular practice?
So I think that utilizing the clinical rotations that students have during their NP program is really vital. You know, talking to your preceptors, observing what goes on in those clinical settings can be helpful, certainly in realizing that what's learned in the didactic is not always what is then carried out in a true clinical setting. So I think that's a good first step. And then I really like utilizing colleagues. I think there's so much that can be learned from working with colleagues. So one of my big pieces of advice for new grads is don't go into a setting where you're the only one, because being isolated, and my follow-up research has showed as well that isolation is really detrimental to the NP transition, precisely for this reason, that there's a lot of unknown and there's no point of reference or comparison and no one to really bounce questions or ideas off of. So for that reason, I think that going into a setting with other NPs ideally, but at least other healthcare providers is really, really vital.
Agree. So much. There's some questions about practice sites and FQHCs in particularly, and talking about that can be really challenging. I mean, personally, one of my first positions was in an FQHC, and I just wanted to say that they definitely are challenging.
Mm-hmm.
But you're just wondering about any specific types of first jobs in terms of retention that you either came across or came to that conclusion with your research?
So yes, and I want to say that my first position was in an FQHC, and that was the impetus for my research. So that goes to show you that it was very challenging for me, and I just came to thinking, what can we do to better support new NPs, because we need them in these settings. So I completely agree with that. I did not find variations in job satisfaction across different settings in this study. But with the complexity, the increased complexity that comes with FQHCs, as well as the social determinants of health issues that are really pervasive in those settings, it certainly makes it more challenging. So it doesn't mean that those are not good settings to practice in. It may mean that a community health center based residency program or transition to practice program may be a really good opportunity to ease that transition. It may mean that within that community health center, one of the things you can do is work with the administrators to carve out more of a niche for yourself to slowly transition into that role. For example, we have one new grad in my current clinical setting that is community-based healthcare, who right now, because she's new and she's very green starting out, she's her schedule is limited to only, acute, straightforward type visits like URIs and UTIs and things like that, while she gets her bearings within the first 6 months, and then she can progress beyond that. Also requesting a dedicated mentor within that setting that you can really go to, maybe let's say once a week or once a month, whatever that looks like for chart review, I think is really valuable as well, to just make sure that you're on track. So I think just having awareness and having those conversations up front is really, really valuable.
Good points. There's a comment actually here from Anita in New Mexico, is talking about the fact that she advises new NPs to keep a new skills checklist with them, with dates and procedures done, and have it be checked off actually as they're doing them in practice, especially those that are skills that are either expected by the practice or ones that you want to learn yourself, and you keep that list with you. A copy for yourself. It can be used for professional development, but also to track your competencies, and that's an excellent idea. So I just wanted to share that with the group. There's also a neonatal nurse practitioner who is using a recruiter-specific person to find a first job, and is asking, should I ask for a transition to practice program to be part of my job search?
Wow, that's a really interesting question. That had not occurred to me, but I say go for it. I really like that. Or if those recruiters do have access to those type of programs, only because the way that recruiters work is that they, get some sort of commission for placing a clinician within a setting. So, and a lot of these transition to practice programs are by application. So I'm not sure that that would work. It doesn't hurt to ask. I say go for it and make the ask and see what they can do for you. Perhaps they can at least present you with what is available, and then you can go forth contacting the programs. But my sense from what I know about these transition to practice programs is that you'll have to make direct contact. And often there is a designated contact person who is often an NP who you can reach out to get more information about the transition to practice programs.
Lots of great questions here. We're not going to have time to get through everything. I'm trying to ask different types of questions. We have a couple more minutes. So we have asked a question here. Someone's asking about what are the primary causes of burnout or job transition for NPs? If you could maybe talk about what those would be for the first year.
Sure. That's a great question. So the main things are role confusion, right? So feeling kind of in limbo, not knowing your place in the organization. A lot of people say they're stuck somewhere between being an RN and being an MD. People don't understand what their role is. They're being asked to do nursing functions. You know, that's why it's so important to really clarify and delineate your state scope of practice as well as the organizational scope of practice, and making sure that you're sometimes will be needing as the NP to educate that organization or that physician whom you're working with and saying to them, well, that's not my scope of practice, that's a nursing role or that's a support staff role, and just being clear with that. So that's a major source of contention, as well as the scheduling and just the volume of patients. So, and the support staff. So, you know, what I've seen is just the sense of overwhelm that these new practitioners are really struggling with keeping up, that they're feeling like they don't have enough time to get done what they need to within the constraints of their clinical practice. The complexity of patients, honestly, nowadays is really necessitates having longer appointment times. So having to, you know, those who have to see patients very quickly in a short period of time really find it to be a source of burnout. And then surprisingly, respect goes a long way. Those who have really good relationships and support within their clinical practice setting, whether it be from their collaborating physician, whether it be from their nurse practice manager, or whether it be from their support staff and their colleagues, that goes a long way in buffering the effects of the stress and the burnout. So that's something positive to look for. And when you're going on your interviews and when you're choosing that position, to make sure that you're choosing the right place, the right people to work with, as much as you're choosing the other things like the salary and the schedule and things like that.
Well, believe it or not, we're coming up on the end of the hour here. We are going to put up your contact information. A number of people have asked for that. I did want to let everybody know, if we didn't get to your question today, we will forward these on, each one of the questions you've already asked, to Dr. Faraz, and we will get back to you. So if you've already chatted something into the chat box, those questions will be answered. So you don't need to contact Dr. Faraz in addition to that. A lot of great information. I wanted to also just let people know that this is the information for us here at the NNCC. Myself and Tiffany Depew, who are working on the Nurse Practitioner Support and Alignment Network. This is our contact information. If you'd like more information about what's going on with practice transformation, please go to the link noted here at aanp.org for more information about practice transformation, as well as the past webinars that we have done. And also there's a link there for additional CE opportunities. So with all that being said, again, I just wanted to thank everybody for their time today, and thank you for all of your great questions. You have helped both Dr. Faraz and I realize that there's probably a whole other presentation about job search and negotiation, and we will certainly offer that in the future. Please join us for the next Lunch and Learn coming up, talking about medication use leading to hospital readmissions. This is a DNP who is working on the central part of the state that has some great information about team care and how to get great patient outcomes. Again, my thanks to everybody for joining today. Be sure to fill out the survey when you get it, and we look forward to seeing you and hearing from you on our next Lunch and Learns. Thanks, everybody. Goodbye.